The diagnosis conversation replayed in my mind as I sat in the oncology waiting room, my third appointment this week. 8 months ago, I'd called my parents immediately after Dr. Chen delivered the news that would change everything. Stage 3 ovarian cancer, aggressive type, requiring immediate surgical intervention and months of chemotherapy. Cancer. My mother's voice had carried disbelief rather than concern. Honey, you're only 29. Young, healthy people don't just get cancer out of nowhere. Dad had been more direct during that first family meeting. Show us the medical records. If this is real, there should be proof. I'd brought copies of my pathology reports, surgical notes, and treatment plans. My parents had examined them with the skepticism of people convinced their daughter was orchestrating an elaborate deception. These could be fabricated, Mom had said, setting aside the oncology consultation report. Medical documents can be forged. We watch the news. People fake cancer diagnoses for attention all the time. The accusation had been devastating, but their reasoning followed a twisted logic. I'd always been the quiet, independent child who rarely asked for help or sympathy. In their minds, a sudden medical crisis requiring family support seemed completely out of character. If you were really sick, we'd know, Dad had declared with absolute certainty. Parents can tell when their children are genuinely ill. This feels like performance. 8 months later, their position hadn't softened despite mounting evidence. I'd lost 43 pounds, undergone 3 major surgeries, and completed 6 cycles of aggressive chemotherapy. My hair had fallen out completely, requiring a rotation of wigs that never quite looked natural. Dark circles under my eyes told the story of countless sleepless nights battling nausea and pain. She's gotten very good at the sick act, Mom had told my sister Lisa during a phone call I'd accidentally overheard. The weight loss is concerning, but people with eating disorders can look genuinely ill. Their theory had evolved as my appearance changed. What started as accusations of faking cancer had shifted to suggestions of self-induced illness, eating disorders, or psychological problems manifesting as physical symptoms. Emma's always been dramatic, Dad had explained to concerned friends who'd noticed my deteriorating condition. She's gotten herself worked up to the point where she actually believes she's sick. The isolation had been almost as painful as the cancer itself. While undergoing treatments that left me weak and vulnerable, I'd received criticism instead of support from the people who should have cared most. My medical team at Regional Cancer Center had expressed outrage at my family's response. Dr. Chen, a 20-year veteran of oncology, had called their denial medically unprecedented and psychologically abusive. I've treated thousands of cancer patients, she'd said during one of our consultations. I've never encountered family members who actively denied a diagnosis this extensively documented. The documentation was overwhelming. Surgical reports describing tumor removal from my ovaries and surrounding tissue. Pathology results confirming malignant cells. Blood work showing the devastating effects of chemotherapy on my system. PET scans tracking the cancer's response to treatment over months of aggressive intervention. Your parents are welcome to speak with me directly, Dr. Chen had offered repeatedly. I'm happy to explain your diagnosis and treatment in detail. But my parents had refused every invitation to meet with my medical team, convinced that oncologists were either being deceived by my performance or were somehow complicit in my attention-seeking behavior. Doctors can be fooled, Mom had insisted. Especially by someone intelligent enough to research symptoms and fake test results. The suggestion that I was sophisticated enough to forge pathology reports and manipulate blood work had been particularly cruel. Their confidence in my capacity for deception exceeded their faith in my honesty about a life-threatening illness. Last week had brought news that changed everything. Dr. Chen had invited me to participate in a special presentation to the Regional Medical Board, a quarterly meeting where complex cases were discussed among the area's top medical professionals. Your case represents several important teaching points, she'd explained. The clinical challenges, the innovative treatment approaches, and unfortunately, the family dynamics that can complicate patient care. The presentation would include detailed medical evidence spanning my entire 8-month treatment journey. More importantly, it would feature testimony from my complete medical team about the psychological impact of family denial during cancer treatment. Would you be comfortable having your parents attend? Dr. Chen had asked. Sometimes family members need to hear medical information from multiple professionals before they can accept reality. I'd agreed immediately, knowing that Friday's medical board meeting would finally provide the irrefutable proof my parents claimed they'd always wanted. The invitation arrived on official regional cancer center letterhead, formally requesting my parents' attendance at a medical case presentation regarding innovative ovarian cancer treatment protocols. I'd forwarded it without comment, curious to see their response. Dad's reply came within hours. "This is getting ridiculous. Now she's got an entire medical facility participating in her fantasy. We need to attend this meeting and explain to these doctors that Emma has serious psychological issues." Mom agreed enthusiastically. "It's our responsibility to protect these medical professionals from being manipulated. They clearly don't understand Emma's history of attention-seeking behavior." What my parents didn't realize was that the meeting was the quarterly regional medical board presentation, attended by the area's most distinguished oncologists, surgeons, and medical researchers. Dr. Chen had arranged for my case to be featured as the centerpiece of a discussion about complex treatment protocols and patient advocacy challenges. "Emma," Dr. Chen had explained during our pre-meeting consultation, "your case offers unique insights into both medical innovation and the psychological factors that can impact treatment outcomes. The board wants to understand how family denial affects patient recovery." The presentation would include comprehensive documentation of my 8-month cancer journey. Initial diagnostic imaging, surgical reports, pathology results, chemotherapy protocols, and treatment response data. Most importantly, it would feature testimony from my entire care team about the unprecedented level of family denial they'd witnessed. Dr. Michael Rodriguez, my surgeon, had been particularly disturbed by my parents' response. "In 25 years of surgical oncology, I've never encountered family members who refuse to believe documented cancer diagnoses. It's not just cruel, it's medically dangerous." The psychiatric consultation Dr. Chen had arranged 2 months into my treatment had concluded that my parents' denial constituted profound psychological abuse that could significantly impact treatment outcomes and long-term recovery. "Cancer patients require emotional support for optimal healing," the psychiatric report stated. "Active denial from immediate family members creates additional trauma that can compromise immune function and treatment compliance." My parents had dismissed the psychiatric evaluation as more fake medical documentation designed to support Emma's elaborate deception. Tuesday brought particularly cruel messages in our family group chat. "8 months of this performance," Mom had typed. "When does the act end?" Dad's response was characteristically direct. "The medical board meeting will expose this whole charade. These doctors will understand Emma's psychological problems once we explain her history." What they didn't understand was that the medical board already knew my complete history, not the fictional version they'd constructed, but the documented medical reality supported by months of testing, imaging, and laboratory results. Wednesday evening, Dr. Chen called to review the presentation details. "Emma, tomorrow's meeting will include Dr. Harrison, the regional medical director, along with department heads from oncology, surgery, pathology, and psychiatric services. Your parents will see testimony from 12 medical professionals who've directly participated in your care. The evidence would be overwhelming and undeniable. PET scans showing tumor locations before surgery. Pathology slides revealing malignant tissue under microscopic examination. Blood work documenting chemotherapy's effects on my system. Imaging studies tracking treatment response over time. We're also presenting the psychological evaluation that documented your parents' denial," Dr. Chen continued. "The board needs to understand how family dysfunction can complicate cancer treatment." Thursday morning, I arrived early at the Regional Cancer Center's executive conference room. The space was impressive, designed to host medical conferences and board meetings for the area's premier cancer treatment facility. 24 seats surrounded a conference table equipped with advanced presentation technology. Medical board members filed in gradually. Department chiefs, research directors, prominent physicians, and administrators representing the region's cancer care leadership. I recognized several faces from medical journals and cancer research publications. My parents arrived precisely on time, dressed formally for what they believed would be their opportunity to expose my psychological problems to medical professionals they assumed had been deceived. Emma, Mom whispered as they took seats across from me, it's not too late to tell these doctors the truth. They'll understand if you explain that you need psychiatric help. Dad nodded supportively. We're here because we love you, but this elaborate medical fiction has to stop. Dr. Harrison, the regional medical director, called the meeting to order as final attendees found their seats. His reputation in cancer medicine was legendary, 35 years of clinical practice and medical leadership. Today's presentation examines innovative treatment protocols for advanced ovarian cancer, Dr. Harrison announced, featuring the remarkable case of patient Emma Richardson, whose 8-month treatment journey demonstrates both medical success and the psychological challenges that can complicate patient care. My parents' confident expressions began to change as the magnitude of their mistake became apparent. Dr. Chen stepped to the podium as the room's large displays activated, showing detailed medical imaging that filled the screens with undeniable evidence. The first slide displayed my patient identification and diagnosis information from regional cancer centers' electronic medical records. Ladies and gentlemen, I present the case of Emma Richardson, diagnosed 8 months ago with stage 3 ovarian cancer, Dr. Chen announced. This case demonstrates both innovative treatment success and the unprecedented psychological challenges created by complete family denial of documented cancer diagnosis. My parents' faces drained of color as high-resolution CT scans filled the massive screens. The tumor masses were clearly visible. Large, irregular growths throughout my pelvic region that no healthy person could fake or fabricate. Initial presentation showed extensive tumor burden, Dr. Chen continued, using her laser pointer to highlight the cancer's spread. Multiple ovarian masses with peritoneal involvement requiring immediate surgical intervention. Mom's hand flew to her throat as she stared at the medical imaging. Those are actual tumors, she whispered in horror. Dr. Rodriguez stepped forward to present the surgical findings. Patient Richardson underwent radical hysterectomy with bilateral salpingo-oophorectomy. Pathology confirmed high-grade serous adenocarcinoma with extensive local invasion. The screens now displayed surgical photographs and pathology slides showing microscopic views of cancer cells. The evidence was overwhelming. Months of documented medical procedures that no amount of psychological manipulation could fabricate. Most disturbing was the complete absence of family support, Dr. Rodriguez continued. Patient Richardson's parents actively denied her diagnosis, refusing to provide emotional assistance during life-threatening illness. Dr. Harrison activated slides showing screenshots of family communications I'd provided. My parents' accusations and dismissals appeared magnified for 24 medical professionals to read in detail. If you were really sick, we'd know, Dr. Harrison read aloud from Dad's messages. This feels like performance. These communications occurred while the patient was undergoing aggressive chemotherapy in our facility. The room fell into stunned silence. Several board members turned to stare at my parents, who sat frozen in obvious shock at seeing their words displayed as evidence of psychological abuse. Mr. and Mrs. Richardson, Dr. Harrison's voice carried barely controlled anger. Are these your communications with your daughter during her cancer treatment? Dad nodded mutely, unable to form words as he stared at 8 months of documented medical evidence that destroyed his theory of fabricated illness. You accused your daughter of faking stage 3 ovarian cancer? Dr. Harrison continued. While she was undergoing life-saving surgery and chemotherapy in our facility? Mom finally found her voice, though it came out as a broken whisper. We thought, she seemed healthy. We didn't understand. The pathology reports, surgical notes and treatment protocols were provided to your family, Dr. Chen interjected sharply. You chose to dismiss documented medical evidence as fabrication. Dr. Patricia Wells, the hospital's chief of psychiatric services, stood to address the psychological impact. In 30 years of oncology psychiatry, I have never encountered family members who maintained denial this extensive in the face of overwhelming medical documentation. This represents severe psychological abuse during critical illness. The screens now showed my complete treatment timeline. 8 months of surgery, chemotherapy, blood work, imaging studies, and medical consultations. The evidence was comprehensive and undeniable. Patient Richardson achieved complete remission despite receiving no family support during treatment, Dr. Chen concluded. Her survival represents triumph over both cancer and the psychological trauma inflicted by family denial. Dad's voice was barely audible. Complete remission? She actually beat cancer. Despite your conviction that she was faking it, Dr. Rodriguez confirmed with cold finality. 6 months later, my parents' attempts at reconciliation had become increasingly desperate. The medical board presentation had been recorded and was now used in oncology training programs nationwide as an example of family dysfunction during cancer treatment. "We thought we were protecting you from making a terrible mistake," Mom had written in a 12-page letter. "How could we have known you actually had cancer when you seemed so normal?" "By trusting your daughter over your assumptions," I'd replied simply. "And by understanding that cancer doesn't always look like movie portrayals of terminal illness." Dad had tried a different approach, suggesting family therapy to work through this misunderstanding. I'd declined, pointing out that denying someone's cancer diagnosis for 8 months wasn't a misunderstanding. It was a choice they'd made repeatedly despite mounting evidence. "The doctor said you could have died without family support," Dad had said during our single phone conversation since the medical board meeting. "We didn't realize how serious cancer treatment was." "You didn't realize because you refused to learn," I told him. 8 months of medical documentation wasn't enough to convince you I was telling the truth. The final vindication came when Dr. Harrison invited me to join the Regional Cancer Center's Patient Advocacy Board. My experience with both successful cancer treatment and family medical denial qualified me to help other patients navigate similar challenges. "Sometimes the people who should support us most are the ones who fail us completely," Dr. Harrison had said during my appointment ceremony. "But surviving that failure while beating cancer makes you uniquely qualified to help others." My parents had excluded me from their support when I was fighting for my life. Now I provided that support professionally to patients whose families had failed them during critical illness. The medical board had given my parents the proof they'd always claimed to want. Learning they were wrong about their daughter's life-threatening illness was a consequence they'd have to live with forever.